Good evening, everyone, and thank you for joining us for another Building Better Business, a practice management webinar series. Tonight's topic is Medicaid and Medicare Part C acupuncture coverage. And our main presenter tonight is David Bibbey, our current FSOMA Vice President. So thank you everyone for joining us tonight. We're looking forward to this amazing topic, and many of you have already connected, so thank you for being here. My name is Natalia Morrison, and I am the Director of Communications for FSOMA, and just like you, I am also a licensed acupuncturist in the state of Florida. But I know that our webinars are not only limited to our Florida community, so I wanted to see if all of you that are joining us would go to the chat box and just let us know what city and state you are currently joining us from. I'm in Miami, Florida, and our presenters tonight are scattered all over Florida, and you'll see where they are in the chat box. I'm sure they'll share it. But we would love to know where you are joining us from. So in the bottom of your screen, you'll see several different icons, and one of them is a chat icon. And that is where we're gonna share information, chat with each other, connect with each other. And then also at the bottom of your screen, you're gonna see a Q&A icon. And when you have questions for tonight's topic, please add it into the Q&A. And questions are going to be done at the end of David's presentation tonight. So make sure you're very specific with your questions so that we know exactly how to answer your question the best way possible. All right, so let's see where you guys are all from. So it seems like all of you are Florida, Melbourne, Bradenton, St. Augustine, Tampa, Ritchie, St. Pete, Delray Beach, Palm Coast, Taken, and Orlando. Wonderful. Thank you guys so much for being here and for supporting FSOMA and everything that we're working towards to help promote and protect our profession. So without further ado, now that we have all the housekeeping under control, I'm going to be here with you guys the whole time enjoying this presentation as much as you are. So welcome, David Bibbey. Hi, thank you for joining us.
Hi, good evening. Thank you so much, Natalia. I also want to welcome from Holistic Billing Services. We've got Antonio Aris on the line with Laura and Melissa from his staff, and they're going to do a little fact checking for me at the end to make sure that we're all in agreement on the details, as well as help support with some Q&A and add comments and context as well. So I appreciate them being here very much. I'm going to take us through a quick presentation with some background information on Florida Medicaid, as well as Part C Medicare Advantage plans, and then some other details about how to get involved and what that might look like. I've got about 35 slides, and I tend to speak pretty quickly, so I'm just going to move through this information. It's important to understand. It's a little bit detailed, but hopefully you'll follow along, and the presentation itself will be made available because there's a lot of links to help simplify you finding information, getting to certain website resources, and I want you to have all of that at your fingertips. So there's a lot of interactive links there. You don't have to feel like you have to take too many notes. We're going to send the presentation in PowerPoint in its entirety and let you use that as needed, okay? And we're of course here to support you with questions either after and then, as questions may arise in the weeks or months to come. I'm going to turn off my video and go ahead and share screen, and you guys will follow along and we'll take questions at the end, okay? Okay, so This title, the subject matter tonight, Acupuncture Coverage Overview for Florida Medicaid, Managed Care Plans, and Medicare Advantage Plans, Medicare Part C. And let's just start with a quick history of state Medicaid plans, just for anybody who may not be familiar with Medicaid. I'm going to do the same for Medicare in a second as well. Medicaid began as part of the Social Security Act in 1965. And the original law gave states the option of receiving federal funding to help provide health care coverage to children whose families have a low income, those children's caregivers and relatives, as well as people who are maybe living with disabilities, blindness, and other disabilities. Federal government has since 1965 strengthened the rules and requirements for states administrating Medicaid plans, and through Medicaid expansion, some states now extend health coverage to other low-income adults. And you'll see the difference with Medicaid plans and Medicare plans. Medicare tends to be for older people, people over 65, and then Medicaid takes care of children, their families based on income and access to health care. In Florida specifically, Medicaid is both a federal and state program that provides health care coverage to qualified individuals. And not everybody's going to qualify for that, so there's an application and a screening process for it. The Medicaid programs are state-run, so Florida runs it. However, the federal government provides rules and regulations under which all states have to comply, and the federal government provides at least 50% of the funding for Medicaid requirements. So it's a little bit of a joint venture between states and the federal government. Based on the federal regulations, states create and run their own Medicaid program to best serve the residents who qualify. And states may choose to provide more services than the government requires, but they can also choose to provide coverage to larger groups of people, extended to different age groups, different classifications of requirements. Medicaid provides health care coverage for people who qualify, usually based on income and their assets, meaning things like property and bank account resources, things like this. So who is covered under Florida Medicaid? This is pregnant women with low income, children of low income families, children in foster care, those with disabilities, certain seniors with low income, and parents or caregivers with low income as well. And the states, like I say, under Medicare expansion, they can expand the eligibility to additional groups such as people with low income who may or may not actually have children. So each state has slightly different requirements, but it's not available to everybody. You have to qualify based on the state's requirements. So how do Floridians qualify for Medicaid? The Medicaid qualification, I was saying, is primarily based on financial need of children, disabled adults, and other qualified seniors. And it's based on an index they call the federal poverty level. And this is used to calculate families' minimum amount of gross income needed to afford things like food, clothing, transportation, shelter, other necessities. And then the calculation is used to determine eligibility for other federal assistance programs as well, things like WIC, food stamps, and things that are based on income. And it's recalculated each year. What is the federal poverty level? What is the index, and how those things are calculated? So people's benefits may come and go based on changes of income status throughout their lifetime. And so in Florida, it says what Medicaid plans are available, and there's basically two options. When you think of Florida Medicaid, there are Florida Medicaid, which is a state-operated insurance plan under which there is no coverage for acupuncture, okay? FSOMA has been working on this for a number of years, but it's a slow process with working with the governor and the state programs. Separate from that, under Florida Medicaid, The other option is what they call Florida Statewide Medicaid Managed Care. And these are privately managed insurance plans that provide benefits to Medicaid eligible Floridians. And these plans all include acupuncture coverage on all of the plans for adults, as well as for children in instances where there's agreement for medical necessity. So there's, just to reiterate, there's state-run Florida plan. There's just one of them, and then there are maybe 8 or 9 what they call statewide Medicaid managed care plans, and all of those include acupuncture coverage. And I'm going to jump to this hyperlink to show you the coverage benefits are determined by county. So this little link right here where it says find Florida Medicare Medicaid by county, let's open that. And here, I'm going to take you to the Florida Medicaid Managed Care website, and you can see that the managed care plans are sorted by zip code or by county. So I'm over here in Citrus County. I'm just going to click on Citrus, and then it'll populate for us. We're in Region 3, and if you scroll down, it's going to talk about the Medicaid managed availability, the plans, as well as long-term benefits. But what we're after is these medical services. And if you, I'm just going to continue to slide down for us. Right here to adult expanded benefits, acupuncture services are number 1. And if you look over here to the right, you'll see there's 4 plans here in Citrus County, all that include acupuncture benefits for adults. Humana, Sunshine Health, and Stay Well. And so you can, visit each of those plans by clicking.
Sorry to interrupt you. You were not sharing the
link?
The screen for the website. You're still on the PowerPoint.
Okay. I don't know. Is it possible for me to do that? I apologize, everybody.
Let's go back to the share screen button. And then follow the instructions and you can select your web browser.
I apologize, guys. Okay, where it says optimize screen for sharing video clip.
No, no, just do stop share and then go back into share screen then.
Okay, thanks guys. Give me just 1 sec. So when I click on that, I've got basic, advanced, and other. Under share, I have share computer sound, optimize sharing for video clip.
No, so on the top, on the section part, you don't see a tile for your web browser?
I have one that says screen.
Try that one. Yeah, so now I can see your web browser, but just the Zoom landing page.
Okay, guys, thanks for your patience. Give me just 1 sec. I'm going to stop share just for a second and ask that when
I can share it if you want me to. So now I see your PowerPoint presentation.
Yeah. And if I, just for the sake of it, just one more second, how about if I try to reopen that link?
Okay.
Did we redirect?
Nope.
Okay, guys. So then we're just going to get along without that. Okay. Everybody has their links in the presentation, and I won't,
Well, I can share my screen. I can go to that website and share it if you'd like, and we can still walk through it.
okay, then let's do that. I just don't want to create a huge distraction with not being able to open those links. And I apologize for not being, okay. So Natalia is sharing this screen now, and you can see here at the bottom of this is the statewide Medicaid managed care plan. And this is a resource to help you determine what Medicaid managed care plans are in your county, because they're done by county. So is it possible, Natalia, for you to go ahead and just populate either your zip code or county and hit continue to the right and then scroll down? You don't have to do both. One or the other will do.
Okay. How about we do yours?
Yeah, so don't put the zip code in, just slide up to Citrus. Click on that, and then take the zip code out and click the blue, yeah. Thanks again, everybody. So go ahead and scroll down a little bit more, Keep going. And so when you get through the general benefits, stop. Scroll up to the next bar where it says adult, right there. So where it says adult expanded benefits, you can see acupuncture is the first item. And here to the right, there's 4 green check marks. And above them, it indicates that Stay Well Health Plan, United Healthcare, Humana Medical Plans, and Sunshine Health Plan are the 4 Medicaid managed care plans in Citrus County. And so if you're asking, who do I need to credential with? How do I, get hooked up with these companies? It'll identify you which of the companies you need to be in contact with, because there's no point in contacting Medicaid Advantage plans or managed care plans that are not in your county, because you're only going to be able to service residents in your area. Unless you have multiple offices, maybe you service multiple counties, but typically it's going to be in the county that you work in. Okay, so let's go ahead and if we can, we're going to exit out of that. I just wanted to show everybody, click on that link. It'll bring you to the landing page, and then how to enter your county to determine what's available for you. Okay.
And we share the link on the chat box for those of you that are joining.
Thanks, guys. So I'm going to move on. And so the full list of statewide Medicare managed plans are United, Stay Well, Sunshine, Humana, those 4 we just saw, but also Florida Community Care, Simply Healthcare Plans, Aetna Better Health Plan, Clear Health, Molina Healthcare, Prestige Health Choice. And so they're spread out all around the state. And you'll find that, at least one, if not more, like the 4 we have are in your area. I grouped these 4 together in blue because Optum does the credentialing for all 4 of those. And so I gave you on this screen an example, and I'm not going to jump to it because there was a bit of a distraction, I think, to in a time, not a good use of our time to jump back and forth. But I included here for you links that you can use to look at the coverage benefits, because sometimes there's questions like, are the benefits any good? Are they lousy? How does this work? Do I need pre-approval or not? Well, each company that provides these Medicare managed care plans has a very clear policy about their acupuncture benefits. And so you can click on Molina, for example, and it's a long document. It's got lots of information. Use the word search for acupuncture and it'll bring you right to the section for acupuncture. Some plans have, unlimited visits for treatment so long as patients are continuing to improve. They may or may not require prior authorization. Other plans may have as few as 6 or, a standard amount of 12 visits. Typically, it'll give you a minimum age requirement. So it may be, when it says adult, it may say 21 plus or 18 plus, but it'll give you the parameters for what's available to the beneficiaries there. So first identify what plans are available in your county, then take a look at their healthcare provider policies, and it'll give you an idea. Is this company somebody I want to, do I want to work, provide care for their beneficiaries or not? But I find that most of the plans are pretty favorable, to the patients. You can certainly divide a patient care plan that's more than just a handful of visits and really be able to provide a substantial benefit. So I'm going to switch from Medicaid to Medicare now real quickly, and then I'll do a summary that compares and contrasts the two in a minute. Medicare is a federal health insurance program created, again, 1965 for people over age 65, regardless of income, medical history, or health status. So in this instance, there's no qualification. It's the only litmus test for it is based on age. It's a benefit for Americans over age 65. The program was expanded in 1972 to cover certain people under age 65 that have long-term disabilities. So there are ways for people to qualify for Medicare benefits based on certain diagnoses like terminal conditions and or stroke, for example, things that may render somebody permanently disabled. And they may qualify for both Medicare and Medicaid temporarily at some point. Today, Medicare plays a key role in providing health and financial security for 60 million older people and younger people with disabilities. The program helps pay for many medical care services, including hospitalizations, physician visits, prescription drugs, preventative service, skilled nursing facilities, home health, and hospice. So it's really an umbrella of healthcare services that fall under Medicare, and you'll see in a minute that they're divided into different plans. In 2017, Medicare spending accounted for 15% of the total federal spending and 20% of the total national health spending. So it's a substantial investment that the country makes every year, and there's a lot of people enrolled in these programs. Most people over age 65 are entitled to Medicare Part A, and I'll get into that in just a second. They or their spouse are eligible for Social Security, if they or a spouse are eligible for Social Security payments, and they don't have to pay a premium for that if they paid payroll taxes for more than 10 years. I'm giving you some background because I want you to understand how it is that people qualify for these plans and what does that patient population look like. This is why a lot of people feel like it's an earned benefit. I earned my Social Security. I've paid payroll taxes for more than 10 years. And at age 65, my health care umbrella or safety net kicks in through a federally funded program. People under age 65 who receive Social Security disability insurance payments generally become eligible for Medicare after a 2-year waiting period. So you may see patients who have Medicare benefits who are under age 65 based on disabilities and a 24-month waiting period. And like I said, they're usually diagnosed with things like end-stage renal disease, ALS, or other, basically terminal and quite serious conditions. Now, like I said before, under Medicaid, there are 2 options. There's a state Medicaid program, a Florida Medicaid program, and then there's a bunch of managed care programs that are managed by private companies. Under Medicare, a similar program exists where when people enroll in Medicare, they can opt for the original Medicare, which is the government-run program that's managed by the Centers for Medicare and Medicaid, or they can enroll in a Medicare Advantage plan. And Medicare Advantage plans are what we're going to be talking about. I included this information, but I'm not going to read through all of it. But I just wanted to say, we hear about the ABCs of Medicare. Okay, there's actually a D and an E and an F. But I'm concerned today. Part A covers inpatient hospital stays and a lot of inpatient facility care. Part B under Original Medicare covers things like physician visits, outpatient services, preventative services. What we're talking about in Part C is the Medicare Advantage program. And this is the program where beneficiaries enroll in a private program, private health plan, such as an HMO, a PPO, and they receive all of the covered benefits of Part A and Part B, as well as Part D, which is for prescriptions. So think of it, the original Medicare program has two parts, but when people take Part C, they're taking a replacement product. They're replacing their original Medicare with a Advantage plan that's managed by a private company. So it's not like once people opt for that, they're not going. It's a little bit difficult to transition back and forth between the programs. But the Medicare Advantage typically has features and benefits that are more advantageous or better for the insured or the beneficiary. And just to get a sense for the numbers here, more than 4.5 million Floridians are on Medicare beneficiaries. Nearly half of them, so about 2.3 million, are enrolled in a Medicare Advantage plan in 2020. So there are more than 2 million people that are on Medicaid Advantage plans that include acupuncture benefits. So I included some background information on the original Medicare, but I'm gonna move ahead to the next screen, which focuses on the Medicare determination for acupuncture. Everybody may have seen this at some point, but I thought I might include it here for you so you understand what, who is eligible and what Medicare covers when it comes to acupuncture. In this instance, it says that Medicare will cover up to 12 visits in 90 days, okay, for Medicare beneficiaries. And for those who show improvement, they will extend an additional 8 treatments. So as long as your documentation reflects a positive outcome and people are improving with care, they're entitled to 20 treatments in any 12-month period. So for each year, they can use up to 20 encounters. And for the purposes of diagnosis, chronic low back pain is the only indication, the only option for treatment under Medicare. In other words, if somebody comes to you for shoulder pain, neck pain, digestive concerns, anxiety, other types of conditions, they are not going to be covered under Medicare or Medicare Advantage products. Chronic low back pain is the only indication that they'll pay for. And that is defined as pain that lasts 12 weeks or longer, and that it's a non-specific and has no identifiable systemic cause. In other words, it's not related to some metastatic cancer diagnosis, an inflammatory disease, an infection, or other disease. Now, what I would say, just for clarity, is things like, scoliosis, degenerative disc disease, spondylosis, any of these things that we tend to see as chronic low back conditions, including radiculopathies, sciatica, neuropathies, they are included. There's an extended list of ICD-10 diagnoses that are covered under Medicare, and we'll provide that separately because there's dozens and dozens and dozens of more specific diagnoses beyond the standard chronic low back pain is M54.5. That's what so we see that over and over again for acupuncture referrals, but there's lots of other codes that are diagnostic codes that are available for that. They also, it says not associated with surgery, but here I would say it's if somebody has a history of surgery, that doesn't preclude them from having acupuncture for chronic low back pain, is so long as it's not part of, let's say, a more recent procedure that's somebody's still recovering from, or a failed back surgery for some other reason. And lastly, it's low back pain that's not associated with pregnancy. The last-ish thing that's important to understand here, I've included it in blue, is the supervision aspect. Under normal original Medicare, this is important, those patients that have regular, straight, original Medicare, in order for them to qualify for acupuncture care, it has to be done under direct supervision in an office setting, which means that it's done with a physician present or in the suite. This does not apply to Medicare Advantage at all. So if somebody is a Medicare Advantage product, and I'm going to give you some examples of those in just a second. Remember what I said. Medicare Advantage is an all-in-one alternative replacement to original Medicare. These are bundled plans. They include Part A for hospitalizations, Part B for physician visits, and they usually include a prescription plan. Going down to the bottom in blue, Medicare Advantage plans cover acupuncture services based on the plan guidelines, but no supervision is generally required for these acupuncture services. This is care we provide in our offices, just like anybody else that's a private care patient. Okay, there is no supervision requirement. The only thing that is required is that the patient meets the low back pain indication for acupuncture treatment, and that the fee schedule through Medicare applies. Okay. If there's any questions on that, we can address it at the end. But I wanted you to understand some background and history. There's straight Medicaid, and then there's managed care Medicaid. There's straight Medicare, and then there's Medicare Advantage. So the distinction is that acupuncture is available in the managed care and in the Advantage plans. That's where, again, I wanted to reiterate. These plans are meant to replace the original Medicare products, and they include 12 up to 20 sessions a year. That applies to both. It's also important to understand that since Medicare Advantage policies are provided by private insurers like United Healthcare, Humana, Aetna, these types of plans, is that they vary from state to state, and so do the details of the plans in Massachusetts are likely to differ from the ones in Florida or California or Texas. Some plans are more likely to cover other alternative therapies as well. So it's worth looking at them on a state-by-state basis. And you'll see if you scroll down, when you looked at the site I showed you for determining what plans are available in Florida through Medicaid, it says acupuncture was the very first one. Scroll down, see if manual therapy is available, see if massage therapy is available, because you may be able to expand your plan of care to include other services other than just acupuncture based on the plan. It's worth taking a second just to understand the particulars of each. The same applies to the Medicaid as well as Medicare Advantage, okay? So quickly on Medicare Advantage, there's basically 4 plans. I described them already. HMOs, PPOs, private fee-for-service plans, and special needs plans. And it's worth being familiar with what each of those are. And I included here some description for you of what is an HMO, what is PPO, what are these PFFS plans, and understanding the difference between them. And lastly, what is a SNP? So I didn't want to go through all 4 of those just because it may be a bit distracting, but take a second. The most popular of the plans under Medicare Advantage are going to be HMOs. And HMOs are famous because they are sort of network driven. Either if you're not credentialed as a provider in the HMO, service benefits will not be available. PPOs can be a little bit more flexible, but basically, if you're to simplify things, it would be best if you identify what plans are available in your community by county, and then credential with each of them. And then you can advertise and treat patients from any of those plans that are in your community. So for the sake of it, I did a little side-by-side between Medicaid and Medicare here, just to remember that Medicaid patients, those beneficiaries tend to be lower income children or families from low income families, as well as some seniors and disabled folks. They provide medical care and long-term care coverage. Eligibility has rules based on income and categorical criteria. They receive federal and state funding, and they're administered on a state level within federal guidelines. Medicare, the opposite. There's no qualification other than age and maybe some early qualification based on disability. It provides medical care coverage, but limited long-term care. It has no income threshold issues, and it receives all of its funding through payroll deduction that people pay into while they're in the workforce. And this is administered on the federal level, not the state. So just some quick statistics, guys. We're at about 35 minutes, and I'll probably be wrapping up in about 10 or so. Just so you know what the patient population looks like. Florida Medicaid adults, under the state program, there are about 4.3 million. These are people we're still working to get coverage for. But under the Florida statewide Medicaid managed care plans, nearly 1 million adults, 900,000. That means about 1 in 14 Florida adults have direct access to acupuncture coverage through a state Medicaid managed care plan, 1 in 14. When you look at Florida Medicare, like I said, about 2.5 million people are enrolled and under the original plan, and here nearly 50% of the total 4 million people, 2.2 million, 1 in 6 adults over age 65 have direct access benefits for acupuncture coverage. 1 in 6 adults. So all of these people, you got to remember, that are over age 65, half of them have a Medicare Advantage product. And it includes benefits for acupuncture that are not supervised, no real difficulty getting referrals or managing those patients. It's just they can walk through your door, put down their Medicare Advantage card, make sure that you verify their benefits, and they can instantly become patients of yours. And they enjoy the same benefits, 12 treatments, demonstrate and document their improvement. They'll authorize an additional 8 up to 20 visits per 52-week period, okay? That was a resource as of August 2020 from Florida Medicaid. So you can see there's over 3 million people between the state Medicaid programs and the Medicare Advantage plans that have direct benefits for acupuncture services in your office. I included here for you, and this may be helpful is it possible for Natalia, if I wanted to redirect people to this page? If I put it up there, can you copy it?
Yes, if you send me the link, I can open it and
Okay, let's
share screen.
And you want me to email that to you? Or I copy paste it?
You can copy paste it and add it to the chat box as well. And that way everyone can see it.
Matt, you know what? Do me a favor. I'm gonna email it to you because I'm having a hard time toggling between sharing and not sharing my screen. Okay.
Okay, perfect.
Thanks, everybody. Just give us 1 second, and I'll let Natalia show you this, because like the resource that I had before for the Medicaid managed plans where you searched by county, you have a similar option for Medicaid Advantage plans. They're available county by county in the state. And this is your resource for determining which plans are available, who do I want to credential with in my area.
And while I wait for the page to upload, I just wanted to remind everyone to please submit your questions in the Q&A section of the screen. I'm seeing a few on the chat box, but I just want to make sure you add your questions to the Q&A section so we can make sure to answer them.
Thanks, Natalia. Okay, so this was set to my zip code, but here at the top of this page, or maybe before we advance to this page, there'll be a place just like you saw before to put in your zip code or your county. and it'll populate for you. And if you scroll down, you can see here in Citrus County, Humana. Again, Humana has several plans. They've got a gold plan, WellCare, Aetna, United Healthcare has a couple of plans, WellCare as well. The only thing, Blue Cross is here. Blue Cross Blue Shield, HMO does not credential acupuncturists in Florida for the Medicaid Advantage products yet. Why they, we're working on that actively. FSOMA has a couple different channels right now with Blue Cross, and we're trying to, peel the lid back on opening a provider network or bringing us into network with them. But here you can see basically Humana, United, and Aetna, and the WellCare is available for Medicare Advantage plans. And use this resource. You can just click on the link that's embedded on the PowerPoint, and you'll be able to find what's available in your county. So you'll know exactly who to credential with, okay? And I just wanted you guys to see what that looked like on the landing page. But go ahead, Natalia, if you want to pop out of there.
I have a question. If I shared this link that you sent me,
Yep.
How do they go and type
I think I would go to the top where it says find Medicare plans. And then I would click over here where it says find Medicaid, Medicare Advantage plans to the left.
Sorry, my internet is slow.
Yep.
Okay. Great. I'll work on that, but I'll stop sharing screen so you can continue your presentation.
Right, but that's a statewide resource, and it's geographically driven. Okay.
Thank you.
Okay, I think good. Okay. So if I slide down here, this is now we're going to talk a little bit about credentialing. Okay.
You have to share your screen again.
Okay, that's.
Now we're on your web browser. There you go. Perfect.
And that's. Sorry about that, guys. Let me slide down so you have my full screen. Okay, so I wanted you to have the resource links so that you can find your Medicaid managed care plans. We looked at that before for Florida. This is the Medicare Advantage plan available by zip code. Now I want to switch gears and talk a little bit about credentialing. The most important thing that you have to do before you start calling and contacting companies is, if you're not familiar with, going to, there's a company, it's called CAQH. CAQH. If you've credentialed with the VA or other insurance provider networks, you may be familiar with that term already. If you have, close your ears for 3 minutes. But if this is a new acronym you're not familiar with, CAQH, go to the CAQH ProView provider portal and you want to create an account. It's free, but this is a portal that captures all of your personal, or I should say your professional data. Who you are, your NPI number, your practice address, your liability insurance company, the limits of that, your education and background. It's a one resource where you have to upload all of these details, your tax ID number, your NPI number, your taxonomy number. It's a little bit of a process, okay, going through CAQH. But once all of the data is uploaded, they'll let you know when they have everything, because it's not going to let you complete your complete adding information until it's complete. That is the universal resource that's used by insurance companies, private and as well as maybe public entities as well, for verifying your provider details, your provider profile. And it simplifies them having to say, send us 25 pages of, documentation that's triple duplicate, made in triplicate. Everything is in one digital place. They can access it and download it. When you complete your CAQH enrollment, you will get a CAQH identification number. You want to keep that in some secure place, because oftentimes when you're doing your credentialing, the very first question they will ask you is, what is that number? Because if you have that number available, you can skip to the end of the credentialing process pretty much and just sign the application to become credentialed, because all of the valuable data that the insurance company or the managed program needs is located there in one place. So before you start calling individual companies, make sure that you go through this process. It's relatively straightforward in terms of following the instructions, but I will say, do it on a Saturday afternoon when you've got a couple of hours to dedicate to finding stuff, because you may not have everything in one location. Copies of your licenses, copies of your certifications, for example, with NCCAOM, copies of your professional liability declaration. All of that stuff is going to have to be uploaded as a PDF to them, and you don't want to be, have stuff strewn out all over the place. Try to do it when you have time to dedicate, okay? And then lastly, I think I just said, there is a fact sheet here if you want to know more about this organization and what they do. Basically, they describe themselves as a business that streamlines healthcare processing, but basically it's about pulling all of your information into one place so that it's easily identifiable. And it has to be updated every year, or sometimes twice a year. You'll do what they call a reattestment, where you have to go back through and verify that everything is up to date and accurate. And if something, for example, your professional liability coverage is lapsed, it needs to be resubmitted with new copy, or your license is expired. All of those things are going to be maintained in a current image or snapshot, okay? But that's going to simplify your life. If that's CAQH is well maintained, then companies that are trying to do business and credential with you, they're going to find your information. It'll be easy to find. Oop. I apologize. Okay, so let's go back to the, under Medicaid, I was telling you before, Optum Health, Physical Health Provider Network covers, this is for the Medicaid managed care plans. They cover United, Staywell, Sunshine, and Humana. You'll credential with Optum. It's the same people that handle the credentialing for VA, and they'll automatically enroll you as a credentialed provider in these other networks with your permission. And I gave you the Optum credentialing contact link right here. We're not going to jump to it. It's a little cumbersome, but this is how you find Optum. I gave you a snapshot of what that landing page looks like. When you click on the link, you basically want to go to where the blue dot is. I am a healthcare provider and would like information about joining Optum Health Physical Health Network. And then below that is a little bit of a cutoff where it says first name. There's a form for you to fill out. They'll send you a credentialing package and get you onboarded. It's pretty straightforward. Again, if you have everything in one place, it'll make life a little bit easier. And then lastly, I included here contact information. These are all of your links. Just open the link. It'll take you to the joining the network for Florida Community Care, Simply Healthcare Plans, Aetna, Clear Health, Molina, Prestige. I wanted to make this as easy as possible for you to find the landing pages. And most of this is done online. They may have a contact form for you to complete, but they will get back to you with somebody who's responsible for credentialing, and they will kind of take you through that process. I guess the last thing I want to say before I jump to the next page is that services are available. There are companies that specifically help with credentialing providers, and they will simplify this process for you. Holistic Billing is one such facilitator. They're going to join us at the end of the presentation for questions, but others exist. But I want you to know that if this feels like more than you want to tackle for a nominal fee, you can just, work it out with a private provider, again, like Holistic Billing, where they'll take the credentialing details and help onboard you into those provider networks. And the way that you know that the process is complete is you'll get a welcome letter from the company. They'll tell congratulations, welcome to the Molina healthcare network, and they'll give you a provider ID and some other information. So once the credentialing process starts, you don't want to start treating or seeing those beneficiaries until you have confirmation that you've been onboarded into the provider network. Otherwise, you won't get paid. Statistics, and I just wanted to remind everybody, I won't go through this again, but there are over 3 million people that qualify for these direct access acupuncture plans. 1 in 6 adults over 65, and 1 in 14 people that either have a means test for low income or disabilities or other barriers to care. So this is it's a fantastic patient population that really needs acupuncture services. They've had drug referrals, they've had ablations, they've had injection series, they've had lots of interventions, but they don't always get the results that are best and lasting. So if they need ongoing care, acupuncture is a safe and effective way for them to do that. They'll become extremely loyal patients and very grateful for the care that we're able to provide. Quickly, understanding reimbursement. I thought this is worth talking about because sometimes we have the sense that it may just not be worth it, but I disagree. Centers for Medicare and Medicaid Services published a physician fee schedule. They do that every year. They apply what they call a relative value unit to any of the CPT codes, including acupuncture codes. And just so you understand, acupuncture is a timed procedure, and it's billed that way with the first increment, a minimum of 8, maximum of 15 minutes for the first unit, and then typically 15 minutes per additional unit for a maximum of 3 units per encounter. So the maximum treatment time that under CMS physician fee schedule they will pay for is 45 minutes. That's the maximum. This includes insertion, manipulation, retention, removal of separate needle sets is required when your claim contains multiple units for acupuncture. So to be clear, claims cannot be processed for multiple units of acupuncture simply based on the total needle retention time for one set. Put in a set, in order to do additional billing for a second or third unit of acupuncture, that requires a separate set of needles inserted and manipulated, obviously removed. And then I wanted to share with you that the fee schedule for acupuncture is currently valued here. We're familiar with the 4 acupuncture codes: 97810, $38 on your initial insertion, and they'll pay $28 for the second and third unit. Okay, so you can do the math. And I think actually I give you an example on the next slide. When it comes to electrical acupuncture, eStim, $42 on your first unit and $34 on additional unit 2 and 3 for separate sets of needles that have microcurrent applied. Doesn't have to have microcurrent applied, just make sure that your claim reflects the care you provide. I think I stated that case. Let's just go right here. So an example of a 45-minute service, this is without manual therapy. And excuse me, I left in 97141 for 1 unit. That does not apply. But what we're looking at here is 1 unit of 97810 for $38, 2 units of additional care. That's a $94 rate on attended 45-minute 3-set acupuncture under the physician fee schedule. Again, if you slide down to the example with microcurrent, with 97813, $42 with 2 units of additional care, up to $110. And so You could, based on your plan of care, you don't always need to use 3 units. Maybe this is a 30-minute timed treatment session. So you want to make sure that you're crafting your claim accordingly. But I wanted to give some context to what a typical claim might look like for a 45-minute encounter. And, what people, the additional time, effort, and energy for documentation and providing and submitting claims is not minimal. There's an investment of time and energy and additional money, but I think that the reimbursement is maybe higher than sometimes people may have expected when they hear about the Medicare fee schedule, because we have multiple units available to us. And again, I just want to reiterate, always choose the correct and best treatment prescription for a patient based on their need. This information provided is simply for illustrative purposes, okay? A couple more slides. I just want to say the value here of a higher volume, low cost care. Most of us have to, appreciate that as acupuncture becomes more and more accepted in the mainstream, as more and more insurance companies include benefits that include acupuncture care, those patients that historically saw us as cash patients now very well may be carrying an insurance card in their wallet that pays for acupuncture benefits. So if we want to retain those patients and continue to see them and provide effective and honest care for them, I think we have to open ourselves to the possibility of enrolling and credentialing in these programs, because it'll be able to help your patients continue with their care. Access to millions of additional patients are being made available through these networks. You also want to realize that the services that you provide are going to be advertised and cataloged by these companies. The members are going to call and say, hey, do I have acupuncture benefits? Yes. Where can I get my services? They will direct them to the credentialed provider network in their area. My phone rings from time to time with an insurance company, as well as a patient looking for care. Sometimes the insurance companies will just place them with us directly. Okay, local patients search the insurance provider network database to find local specialists. They're actively looking for us, and they will find you in that provider network with these companies. You can use local advertising. Take out a small ad in a local paper to communicate that you're credentialed with these companies. For example, just saying, now accepting Humana Gold and, Aetna Better Health. Your phone will ring. People will see that and they realize, hey, I'm insured by that company. I want acupuncture services, and they're going to come to you. You don't really have to do more than that. Just simply announce that you're taking new patients based on these plans. In the end, it's going to help reduce the cost barriers for patients that are new and also returning patients. We've all been through the experience of giving somebody a plan of care, discussing multiple treatments, discussing the cost of services, and having them just unable to budget for that kind of care. Having the insurance benefits reduces the cost barrier, and it makes it much simpler for you to generate new patients and maintain plans of care. This translates into greater compliance, and people will stay through, it's disheartening sometimes if you have a plan of care that includes 6 or 8 treatments and somebody just comes twice. They're not going to get the benefits of care they need, and it also impacts your practice. So here, you're going to generate greater compliance with people actually coming and completing their plan of care with you. You'll have greater number of patients tapping into millions of people covered under these plans, as well as patient referrals from physicians. They feel a lot more confident sending you patients for care when they know that the insurance benefits are in place to pay for that cost of care. It's difficult for physicians sometimes to knowingly say, I'm going to refer you to a plan of care that may cost hundreds of dollars that the patient may or may not be able to afford. And then lastly, I'd say from a practitioner standpoint, embracing this higher volume, low cost of care also reduces our income volatility. You can plan and project and develop a little bit steadier income from week to week, month to month, year to year, and project the growth and trajectory of your practice based on the availability of patients who have the better part of, say, 20 treatment encounters covered by their insurer. Other considerations it. You have to, I just want you to be familiar with the policies of individual plans. Take a few minutes to make sure that you understand and follow the rules for these plans, because there's nothing more disappointing or aggravating. And I know from FSOMA standpoint, we get a lot of feedback from the membership where people say, you know, this plan did me wrong, or they, you know, they only let me do a couple of treatments and they won't authorize any more. Typically, when we dig into the details of those questions, we find out that the policies are very clearly identified in the policy plans that are made available to the providers. So just take a second, usually a small section on acupuncture. It'll tell you exactly what's available and what's required. Knowing that will save you a lot of headache and heartache when it comes to, you know, providing care and expecting to get paid. Lastly, creating and managing more documentation. There can be a little bit more documentation involved, but typically if you format your SOAP note to reflect your encounter, it includes you know, a diagnosis, a point prescription, a plan of care, an area for feedback on improvement, changes either by reduced pain scale, reduced medication use, increased quality of daily activities. These things are all going to reflect positively on keeping people in a plan of care, but they have to be in your notes because that's what case managers are looking to review. And then lastly, it's important that you review your own office policies and procedures to reflect changes in the staff expectations and in the patient trends when you're managing maybe a new group of patients from Medicaid and from Medicare. It may be slightly different than your traditional cash patient and for acupuncture. So you want to ready yourself from a policy and procedure standpoint, and also talk to any staff members so that you guys are all on the same page about how you manage those patients. Takeaways from my presentation tonight and my own experience with some of these managed care plans is that serving these beneficiaries can be a welcome opportunity for many providers to build the kind of reputation and practice they always envisioned for themselves, especially when you're trying to impact positively on your community. You can help build a busy practice that's thriving, a patient-centered practice that really helps people that need your care the most and may not be able to afford it. It could, you know, definitely community-minded, a respected practice among your healthcare peers, one that's valued, one that's modeled by your acupuncture professionals and, you know, colleagues. They're going to see the type of impact you have on your community by working with maybe more patients that are a lower income scale that have disabilities. They have a higher barrier and threshold to care that's finally come down to include safe and effective acupuncture. And this is an opportunity for us to thrive and be successful in every way, really contribute to our communities, you know, reflect some of that patient-centered care that we hold dear, and also grow and thrive and partner with other providers. And I hope you have enough information here in the presentation to be able to find the resources you need to identify what plans under Medicaid and Medicare Advantage products are in your community. You have the credentialing links there. You have the policies and procedures manuals that are there that help describe what those acupuncture benefits look like. And I hope that, you know, they're all activated, turned on, and easy to use. I apologize for not having all of the interactive features to make it easy for me to do that with you, but frankly, it may have taken another 20 minutes. So I kept us on just about 60 minutes tonight with the presentation. So at this point, I want to thank Antonio, Melissa, Laura for being in the wings, and invite them to fact check, you know, anything I said that they think they want to qualify, and or make, you know, add any comments that they think may be helpful. And we'll take questions at this time as well. So I'm going to stop my screen share. We'll go back to the video model, okay?
Hi, David. This is Laura with Holistic. I think you did a wonderful job and provided perfect information in regards to the opportunities that exist for accepting these plans. And some of the questions that were asked, if we wanted to start hitting on those, there was a question regarding if you have to be a Care Plus credentialed provider if you go with Humana. That credentialing is done separately. each one of those organizations handle them on their own.
Wonderful. Thank you so much. And let's go ahead. For those of you that have submitted your questions in the chat box, please make sure to transfer them to the Q&A section, and we'll start reading out and which ones we'll be able to answer tonight with the time we have left. So the first question that comes up is, so what is the advantage of the Advantage C plan?
I would say the advantage is that there's no direct supervision requirement. In other words, you can treat those people that are enrolled in Medicare Plan C, Medicare Advantage plans. They have direct access care with you in your office. Unlike people who do not have those Medicare Advantage plans, their requirements are prescribed by Medicare, and that requires direct supervision of a medical doctor or a DO, where acupuncturists would be physically in a medical doctor's office providing services under supervision, and the claim submission would be done under the provider group. The medical doctors, either group NPI or some other NPI, because acupuncturists are not included as providers under original Medicare. Then the billing and the claims processing and even the medical necessity even is managed by the main provider or provider group that's a medical doctor. So that is possible. You know, we can be hired into medical offices and treat patients under original Medicare, but here in Florida we have equal amounts of beneficiaries for Medicare enrolled in either the original plan or the Medicare Advantage plans. And so from my perspective, I'd rather work in my own office the majority of the time, and those patients can come to us directly.
Wonderful, thank you. And I wanted to make sure to say that we invite Antonio, Laura, and Melissa to jump in and help us answer these questions as well as they come up.
Thank you. Yeah, I say that, you know, because they're experts on the claim side of that, and I just wanted to, and they also help. They also manage and process claims for non-acupuncturists, so they are very familiar with the original Medicare guidelines and standards as well as Medicare Advantage. And I just wanted to make sure that, you know, we're unrolling and unpacking this information as accurately as possible.
Next question. Do we need to be in network or sign up in some way for these plans? The 4 plans that you mentioned.
Yes. That's why I wanted you guys to use the links available to find the Medicaid managed care plans and the Medicare Part C Advantage plans. There's a link to each. They're available throughout Florida, but they are active and doing business county by county. So you want to identify both the Medicaid managed care plans as well as the Medicare Advantage plans that are actively being sold in your county. That resource is available on those links, and it'll help identify which companies you want to be contacting.
And to add to that,
yes. The answer is yes, is you have to be enrolled. Go ahead.
Just to add to something that you had stated earlier, the first reaching out and reviewing all of the plans before you actually follow each payer's process for their credentialing, and each one will be a little bit different. You want to start with CAQH, as you had mentioned earlier. That's like your first step. Yeah, because each payer is going to reference back to that, like you had mentioned before.
And some require it, some don't. But if you don't have that resource, then you got to prepare yourself for an arduous credentialing effort. It is difficult, and it almost is built to discourage you. Do the CAQH.
Wonderful, thank you. So, with other plans, you wouldn't be able to write someone a super bill and that patient would submit it directly to their Medicare or Medicaid plan, correct?
I'll defer on that. I think under these plans, we take their specialty copay at the time of service and you submit a claim. But is there an option maybe, Laura, for providing a super bill where the office provides services and the patient submits to their Medicare Advantage plan directly?
It's going to depend on the plan and the patient's benefits. There are sometimes those options. For the majority of these plans, there's no out-of-network coverage, so it goes to the in-network process. And then it's just going to depend on your contract, really. I mean, if you're going in-network with a payer, typically you're the one that's going to be billing the claims.
Yeah, and it's also a convenience thing. I mean, sometimes you're dealing with patients that are in their 60s, 70s, 80s, forcing them to process a claim sometimes is its own barrier in a way. We have the electronic and other means to do this, so hopefully you embrace that process and make it as easy, reduce those barriers, help them through the process.
Right, good point. Next question. When you say we follow the Medicare fee schedule, does it mean the rates up to 2 15-minute segments, but no E&M?
Right, so under Medicare, actually Antonio clarified this for me earlier, and if I misstate it, keep me straight. Under Medicare and Medicare Advantage, or pardon me, under Medicare and then by extension Medicare Advantage plans, is that they are reimbursing for acupuncture services only the 4 procedure codes. They're not reimbursing on evaluation and management time. Which is in some ways bundled into our timed unit. So, because we're not Medicare providers in the strictest sense, even though we're available for providing direct care under Medicare Advantage, the answer is no. We're just going to use the 4 procedure codes. The reason why I said double check the benefits, under whatever plan you're credentialing and providing care for, because where it says that somebody's available, they have benefits for acupuncture. If you scroll down in there, and it includes massage or manual therapy of other types, is that you very well may be able to include manual therapy services, including massage, in your claim. And so that it's, even though it may, in the strictest sense, there's some allowance for that as a bundled service as part of our 97810 or one of the added CPTs, the additional units. If it's available under their plan, it's in your scope of practice. You've articulated in your SOAP notes that you provided, multiple procedures. You did an acupuncture procedure that was timed, and you include the time parameters for that. And then you went ahead and included a massage or a manual therapy, 1 or 2 units. So long as their plan includes that, they may very well reimburse for it. I think Laura can maybe speak to that as well, but obviously, if the more you know about their plan, the better that'll work out for you. If it doesn't include massage, then you're guaranteed not to get paid on any manual therapy claim or portion of the claim. But if it does include it, and it's medically necessary and included as part of your plan of care, then you may be reimbursed for that as well.
And I hate to always go back to it will depend on the plan, but unfortunately each plan is different, and what they will contract the provider to perform within the contract could be different from one to the other. So you may have one that just does the 4 codes while you have another that does, additional ones. It's going to be based on your contract verbiage.
That, and I would, at this point, I'd sort of jump in too and say, this is why verification is so important. You want to make sure that you know what your plan of care is, or what a typical plan of care is in your office, and that when you're verifying benefits, that you're asking those questions. Under what circumstances is a manual therapy available? And they might tell you straight out it's not. But you can do your research, especially on the Medicaid managed care plans, because it includes those green check marks that I showed you. You can scroll down a little bit further below acupuncture, and it'll show you that it includes transportation, it includes massage, it includes medical equipment and devices. You know, it may have a whole host of things that are included, and that might that may be available under your billing. It just depends on how you're credentialed, how you're viewed and used by the carrier as a provider. And I say this because you don't want to get into, you know, creating a super bill that has, you know, elements to it that exceed what they're going to pay, because it's just going to add to your frustration. Like, I didn't get paid for this or that. But if you know going in, they're only going to pay for 4 codes, then, you know, comport your plan of care to match what they're going to provide you, and you know, keep your blood pressure down.
Thank you for that. Our next question is, I'm already credentialed with Optum. Does that help me?
I would say when you credentialed with Optum, usually it's a tremendous long form that includes United Healthcare, I think WellCare or Stay Well, a couple of other programs that separate from the VA entirely, that have to do with Medicaid managed care plans. And there was a box to check, you know, do you want to credential with these other organizations? And usually it calls for additional signatures. If at the time you did that, you said, for example, no, I just want to do VA Community Care Network, then you probably, you know, they didn't process you for those other companies. You might go back to them and say, and ask, you know, the best way to know it is, you know, did you get a welcome letter from those other companies? And if you did not, and you want to be, then you might just contact Optum, because they're managing your provider profile that way, and they do the credentialing for those other companies. And then, like I say, I highlighted the 4 in blue that were related to Optum under the Florida Managed Medicare plan, Medicaid plans. The other, Molina, Healthcare, Prestige, Aetna, Better Health, and those are separate. You have to deal with them individually, and or, I say, work with basically a credentialing entity, broker. Again, I say Holistic Billing provides those type of services, and they will bring in whoever in your county is available. You'd be credentialed with all of those entities.
Okay. So I wanted to ask you, David, it's already 8:17, and
Yep.
we usually do an hour. We have 16 questions left on the queue, and they're all really great questions. So
Right.
do you want to go for a few more minutes if everyone is up for it? And then when you're done, and when you're ready and we don't finish the questions, I can send them to you.
That's fine. We have everybody live. The questions are there. I'm happy to continue answering questions as long as people need. We can share as much information as we can tonight, as long as our colleagues from Holistic are willing to stay with us. And then if there's additional questioning, they can reach me at david@fsoma.org or through Natalia.
Yes, and I'm going to add those email addresses to the chat box, so all of you can copy and paste them and save them onto your contacts. All right, so next question. How do we find people in our area who have direct Medicare Advantage acupuncture benefits?
Let me toss that to Antonio. Is he with us still? Yeah.
Yes, he is.
Thoughts on that, Antonio?
So typically it's going to be based off the patient's participation in the plan. So usually it works the other way around. Once a provider participates in the plan, their information is published on the plan's website as a participating provider, and then the patient finds you.
Wonderful, thank you. Next question. Since I graduated from a Florida acupuncture school in 1996 that was not accredited, will I be included? For coverage, I guess. David, you have your mic on mute.
Yeah, I muted because I have the water in my building is making some noise. If there's a whistling in the background, it's the people next to me. Okay, what I would say is this, under CMS's national coverage determination, it includes the requirement that it's an ACOM accredited school. But since we're not credentialing with Original Medicare, at this point, what I would do is the privately managed Medicare Advantage plans and the Medicaid statewide plans, those are privately managed, and the criteria for provider network is determined by them under the guidelines of Medicare. I think it's worth it to demonstrate that the strength of your ability to provide acupuncture services are included in the fact that you've a long-term licensee, you have an active and current clear license without any investigations or disciplinary actions. You're insured adequately, and you're ready to go. And let the plan determine that criteria. In my mind, I think that these privately managed plans, they didn't ask for a transcript. When I credentialed, where they would say it's from an ACAOM accredited school. I think it's based on your an active clear license and your liability being in place. So it's hard to answer that question. I'll toss that to holistic billing as well, but I think it's certainly worth pursuing. And if it becomes a question, then there may be some alternate means test or way to resolve that. You may have another way to satisfy it. Antonio, Laura, Melissa, any thoughts on that from a credentialing standpoint?
Yep, each payer may have their own requirements, and I definitely think it's worth a shot for reaching out to them individually. It may not have an impact. Some require specific licensure, like you mentioned. Others do not require it. So it's just going to really depend on the plan, and if it's something to explore, I would recommend it as well.
Because basically, if you have an active clear license, you're able to demonstrate that you satisfied the requirements of your medical board and the state minimum standards for licensure. So you're qualified to provide acupuncture services in Florida, and that should satisfy them. And there may be instances where they drill down a little bit more deeply on the certification of your degree, but it's certainly worth pursuing.
Wonderful. Next question. If we credentialed with Humana, do we have to take Care Plus because it's owned by Humana?
So sorry, I had jumped into that one earlier. They're actually two separate credentialing processes and plans. So you may take one without the other, is how they're set up. I don't know, David, if you have more to offer on that one.
You're right. And so, providers have a lot of control in this process. You're not going to get swept downstream because you sign a contract with Humana. And they have separate plans, they have separate enrollment criteria, separate cost analyses for their beneficiaries. And as providers, you can I don't even say opt in, you can either participate in a plan by signing a provider agreement to service that network or not. And so if they have multiple plans under the same company, you should expect that you'd be credentialed separately for each of those plans, because each of them have separate provider networks. They may overlap, they may be shared providers, but they are distinct. When you call and verify benefits, they're looking to see, that the member ID that you're calling on belongs to a specific plan and what benefits are associated directly with that plan.
Wonderful. Next question. Does Medicare Advantage plans only cover CLBP as well? I'm assuming that's chronic low back pain.
So yes, that's. I'm not aware that they're taking other for other indications. I think, and certainly, I think if you were audited or your claim or your interaction with a patient was scrutinized for any reason, and it was determined that you were treating them for something other than chronic low back pain, even if it wasn't established at the outset, that they would probably then make a determination that it was, care was provided outside of, what the benefits allowed. Any thoughts on that from you guys, Antonio, Melissa, Laura?
Prior to earlier this year when their coverage determination came out for CMS, there was plans like Simply that were out there offering and did not have the diagnosis exclusion because it didn't really exist then. So yes, I would say the majority are going to follow this guideline because now it's published.
Yeah.
But again, if you have a specific diagnosis and you want to run it when you're running the verification, I would always recommend to do that.
Yep. And I would only add that, remember, I said M554.5 is our standard low back pain identifier, but CMS has got an expanded list. It's got probably 50 or more related indications for chronic low back pain. So its complexity and or its presentation, things that you might not think of classically as low back pain, like sciatica or radiculopathy or something like this, it's bundled under that same diagnosis. But again, this is another question. If you're going to be taking these patients, treating this population, and you're going to be subject to the criteria of those plans, I would, I'll make it available. I have it in a PDF. It's something that you want to take and stick somewhere in your office and make sure that, whatever it is that you, whether it's somebody that's referred to you or you're making a determination about, how this fits into an ICD-10 code, to make sure that it's on that list. Don't, create a new one or pick something that's not otherwise indicated under the accepted ICD-10 diagnostic codes for chronic low back pain. And there are many to choose from. I don't mean to make that sound like it's difficult. There's tons to choose from.
Yeah, that was a great question. And before we continue with the rest of our questions, I just wanted to remind you that this presentation tonight is being recorded. We are going to upload it to our YouTube channel by tomorrow. If not, it'll be on by Wednesday, the latest. And we're also we put it on our website, on the FSOMA.org website. And attached to that, if you're a FSOMA member, you'll be able to get access to the PowerPoint presentation that David created for us tonight. If you want me to email it to you directly, please reach out to me at natalia@fasoma.org or support@fasoma.org. Once David sends it to me, I'll be able to send that to you so you can have it for reference. So our next question is, I'm on the border of Pasco County and Hernando, but I reside in Pasco. Can I treat patients from Hernando County as well?
I'm going to leave that to Laura, if you have thoughts on that.
So it might depend on where or who handles your credentialing for a payer. But if you're on a border, I would check both that represent if they are the same in the two areas. Then it's not based on where the patient is. If they're covered and you're in network, they can see you if you're, across the state, if it's the same payer. So it's not really based on where the patient is from, as long as you're in the network. Does that make sense?
Yes, wonderful. That was also a really great question.
And sometimes, a lot of times, it's sort of the availability of these plans is kind of regional. So, I mean, there is probably some place where it's available in this county and not available in that one, and they're right next door, but it's kind of spread out around geography of the state, where it's a little bit different up in the Panhandle than it is in South Florida, than it is in Jacksonville. So a lot of like multi-county zip codes are covered under the same plans.
Yep.
Wonderful. Do patients need referrals from primary care?
I would say it depends on the plan, and we keep coming back to that, because when you go to the provider policy handbook that all of these plans make available on their website, just so you can either determine it when you verify the benefits, but it's nice to have this information at hand. You can just download it, photocopy it, make yourself a little cheat sheet, and you'll know, it'll state right on it, referral, yes or no, the age, the number of encounters, or treatments that they'll pay for. It's usually 3 or 4 categories that same information is available over and over again based on the plans. So I want to say under, for example, Ultimate Health plans, they ask for a referral, and I want to, but under United, it's not necessary. Some of them, it just says no, they can come. You just have to submit documentation when you process the claim. So again, I don't mean to give it long-winded. Check with the plan. It'll be a very clear yes or no.
I think that's kind of the catchphrase for tonight's presentation, is that it depends on the plan. And I think
it's a good question. And I would say they're probably split, like half of them don't require it and half do. It's just a matter of who's in your county, who you're dealing with, which of these companies you're filing the claims with, and you'll come to know this, within 3 months. If you're seeing this patient population, you'll know. And frankly, in instances where we've needed PCP referrals, that's a relationship issue between your patient or the beneficiary and their primary care. And typically the primary care is open to doing whatever is going to, help their patient, and make their patient happy. So I don't know that I've ever had a primary care refuse to give somebody a referral. And it actually, in the instances where it's required, it actually facilitates the whole process a little bit, because the primary care generates a referral. They send it to the insurance company, and the insurance company will call me and say, I have a referral for, Mrs. Smith, and I'd like to schedule her for next week, or, what do you have available? And they get involved in getting that process rolling. So it can be quite helpful sometimes.
Yeah. But I wanted to point out, that's why, or we have, as in FSOMA, we have several business members that are insurance billers. So with the catchphrase of it all depends for tonight, because it requires an expertise and knowledge and time. So we do have some FSOMA business members that are insurance billers, holistic billing being one of them. And if you're looking for a biller, please let us know. We can share with you that contact information as well. So next question, with the Advantage plans, is the copay collected from the patient as well?
Yes, and it has to be.
Since a Medicare patient now has coverage for a chronic low back pain, can we now still treat the patient on a cash basis? Or do we have to have them sign an ABN? Or does that only apply to medical doctors?
I think to answer that question, it's not necessarily that it only applies to medical doctors, but it only applies to Medicare providers. So you may be a Medicare provider that's not a medical doctor, like a physical therapist or a chiropractor or someone else. Acupuncturists are not Medicare providers. So the ABN does not, is not something that we need to deal with until it's such a time that that we do become Medicare providers.
Okay. Where can we find the related information for enrollment?
Use the slides. And I don't mean, what I say by that is that you have hyperlinks that are in blue that will take you to the landing page for all of the companies that were identified there, and just follow along. Some of them are submitted online. Some of them require you write a letter expressing an interest in joining their network, which is literally 2 sentences. I'm interested in joining your network, and you send that to by email, and it kickstarts a exchange of communication with their credentialing department.
All right, so there's a question in our chat box. Do you know if the VACCN follows the same guidelines for billing as Medicare Advantage? And we have Antonio that has responded, and I wanted to read it out to everyone joining us. It says, no, they will have similar, but not exactly the same guidelines. So you cannot assume that they will be the same. Right. And thank you, Antonio, for helping us answer.
Remember, so the VA is not included under CMS. The Centers for Medicare and Medicaid They do create a physician fee schedule, but from administering the, you know, the policies and procedures, who qualifies, what the qualifying diagnoses are, those are all completely separate standards that are developed and managed by the VA. The VA is an independent agency in that way.
Wonderful. So, oh, let me see. One more question came in. Nope. All right. So that completes our questions. Thank you, everyone. You guys submitted amazing, amazing questions. And I'm so glad that we were able to cover all of them in detail. Please make sure David did share with us his email. So if you have more specific questions and you would like to engage with him, you can email him at david@fsoma.org. And our recording will be up on our YouTube page, like I mentioned earlier, in the next 2 days, hopefully in the next 24 hours, if time permits. And on the FSOMA website is where we will upload the PowerPoint presentation. But if you would like me to email it to you directly, please reach out to me at natalia@fsoma.org or support@fsoma.org. And once David sends me the PowerPoint presentation, I will go ahead and forward that directly to you so you can have for your records and as reference. And I wanted to also thank Holistic Billing, Antonio, Laura, and Melissa for spending part of your evening with us tonight and sharing with us your knowledge and expertise and helping us answer all these questions and just being a really great resource and support for our community. So thank you again for everything that you do.
Thank you so much, you guys. And I want to invite everybody. So, you know, if you feel like you get overwhelmed or, you know, stuck at some point where you're trying to, you know, find information or you're having difficulty communicating with the credentialing people, send me an email. You know, give me an opportunity to help maybe shed some light on that process for you. I don't mind taking those questions. I invite you to do that. If it makes the difference between you getting, you know, stymied, stuck and not completing it, or actually getting through that process and then giving yourself and your community an opportunity to use and share more acupuncture, okay?
Wonderful. Thank you everyone so much. And hopefully we will see you next Monday night for another Building Better Business. Thank you, David, for everything that you do.
Thanks so much for hosting.
Right.
Good night, everybody.
Good night.